Thank you. Thanks very much. And thank you, Dan, and your team for setting up this event. We need to question everything, absolutely everything about this pandemic. Prior to 2020, you would not find a single textbook of public health or set of guidelines that included an endorsement of the practice of quarantining the healthy. Just didn't exist. You would often find these guidelines even ruling out mandatory quarantining of the sick. Yet when lockdowns arrived, those guidelines went out, along with even the processes that had been set in place to amend them. They were just ignored, and we locked down. Even worse, no governments who implemented lockdowns conducted any form of cost-benefit analysis. And we noticed this, and many people noticed it. When putting together the analysis of how economic impacts of lockdowns translate into public health impacts, researcher after researcher could not find any result other than that the impact of the lockdowns themselves would have a public health consequence at least an order of magnitude bigger than any plausible benefit that might stem from lockdown in terms of its capacity to flatten a curve. And it got worse. Struck by the immense regional differences in coronavirus mortality, you had Europe and the United States with quite a high disease burden, and virtually the rest of the world at one stage had no epidemic going on. So researchers looked into what might be the causal drivers of this analysis. And in doing so, they inserted all these measures into their analysis: lockdowns, mobility reductions, the effectiveness of test and trace, border closures. And they kept on coming up with the same result, 0. Even sometimes a worsening, a pro-contagion effect from lockdown. And that early research, dating back to May or June last year, was replicated by dozens and dozens of papers. Now, I'm not saying that there were no papers that found lockdown to be effective. There were a few, but they had one essential error in common. And that error was that they failed to observe that all epidemic curves show a reduction in the rate of spread over time. Even the models that put us into lockdown have that as a feature. From the very beginning, you get a reduction in the rate of spread as the number of susceptible people is declining by virtue of having been infected. And these handfuls of papers that showed a positive effect all made this error. They saw a reduction in the rate of spread and they attributed it to lockdowns. What compounded this was that there was a public perception and a media perception of the notion of universal susceptibility. It was thought that everybody was susceptible to this disease. And from that came the idea that we're not all safe until everybody is safe. But the narrowness of the susceptible group was actually evident very early on. As early as February of last year, the WHO pointed out that 80 to 85% of all people who contracted COVID would not require hospitalization at all. Now this, as it turned out, was actually quite an underestimate. But by the end of the first quarter of last year, it was already very, very clear that under 70s who did not have severe comorbidities faced very low risk. We're talking below 0.01% infection fatality rate. 96% of the cases in the European epidemic, the cases of death in the European epidemic, involved severe comorbidities, one or more. But this was completely ignored in the dialogue. In the World Health Organization's press conferences, there was no mention made of this fact. And it's a stark fact. The infection fatality rate for old people is thousands of times greater than the infection fatality rate for young people. Yet if you analyze the press releases of the World Health Organization, what you find is that they mention children 100 times more often than they mention the vulnerable and the elderly. The exact opposite impression is created from what reality really tells you. That there was pre-existing immunity or cross-immunity should not have come as a surprise to anybody. It's long been known that the immune mechanisms involved in the response to viruses are very, very broad, very diverse. There's a big repertoire, as they say. And the ICTV, which is the International Commission for the Taxonomy of Viruses, in a paper in February of last year, actually pointed out that SARS-CoV-2 was not a distinct species of viruses. It was, in fact, an individuum of SARS-CoV-1. And nonetheless, in that paper, the very strange move was made of naming the virus by a completely different name. It should really have been called SARS-2. Instead, it was called COVID. And with that, the myth of an entirely novel virus was spawned. And it was the collision of these two falsehoods, of novelty, of universal susceptibility because of it, and the effectiveness of lockdown being misperceived, that led to an incredibly tragic set of outcomes. Because when we looked around the world, when media and public health people looked around the world, and this vast mortality that had been expected was nowhere in evidence, they concluded that lockdowns had worked. But very early on, Sweden gave the lie to all of this. Modelers had predicted that Sweden, if it did not lock down, would suffer within weeks 90,000 excess deaths. In the event, Sweden famously did not lock down, and by the end of the year, it had experienced nothing particularly significant, between 0 and 7,000 excess deaths, depending on how you measure it. When this was observed, it should have meant the end of lockdowns. It should have meant the end of lockdowns. So what Sweden had gotten right was to separate politics from science. And what it did was sensible, and what it did, contrary to what the newspapers all said, did not result in the tragic outcome that had been forecast. This kind of madness extended into other domains, not just epidemiology. Even in virology, we found that what had been known for ages was being thrown out. We know that, as I said, immune responses are very broad to viruses. And we know that multiple epitopes are from this broad repertoire will land on any particular virus. So if a virus is closely related to other ones, we can expect that elements of the immune system will recognize it. Yet, if you even mentioned T cells at one stage in this epidemic, you were held to be aligning with Donald Trump, this basic fact of immunology. You could be cancelled, you could be censored, and many people were. And the politicization carried on with many other elements So, for example, airborne transmission. Yeah? When we first noticed that lockdowns and social distancing and so on were not having the effect that people were predicting, we posed that maybe, just maybe, this coronavirus, like all the other respiratory coronaviruses, might be airborne transmitted, aerosol transmitted. And that was enough to cause people to call us conspiracy theorists. It's quite extraordinary. And it also, for us, explained another observation. You know, when Florida and Texas opened up, and Biden famously said, they're Neanderthals. And Eric Fagelding said, I have no words. They were all expecting this massive catastrophe as a result of the opening up and the end of the mask mandates, but it didn't register a blip. The decline just continued as Texas and Florida opened up. Nothing happened. Okay? That can also be explained by this aerosol observation. Okay? But if we say this now, even on this very day, you're prone to being banned from YouTube for saying it, for making this observation. And so we went. Vast false narrative was spawned. There were many elements to it. I'm going to read. Lockdown efficacy, universal susceptibility, the extent to which the virus was novel, droplet and fomite transmission, mask efficacy, asymptomatic transmission as a driver of disease, the validity of PCR diagnostics at high thresholds or using insufficient primers, testing of asymptomatic people, the denoting of asymptomatic people as cases for the first time ever, the counting of deaths based on PCR positivity alone, even long after the resolution of infection, the dogma that there was no early treatment or no treatment possible, the utility of contact tracing and test and trace, the exaggeration of outdoor transmission, which is really non-existent, variants that were to affect the young, or variants that were going to be suddenly more lethal. All of these were essentially lies, but they were loudly promoted by a captured and fundamentally controlled media. And alongside that media, you had the fact checkers who were ready to pounce with, and in very unscientific fashion, quite often. And you had the censors who would pull down any dissenting voices. And we're at risk now of this very decrepit way of going about engagement and scientific debate becoming institutionalized and homogenized in a very scary fashion. We have these Orwellian ministries of truth coming into formation, such as the Truth Initiative, and the creepiest one of all for me, C2PA, or the Coalition for Content, Provenance and Authority. The dangers of propaganda were obvious really early on in this whole story. Countless swarms and armies of bots were unleashed by the CCP, projecting onto the world pictures of falling men in the streets and fumigation of streets and this general apocalyptic vision. Yet nowhere else in the world have these things ever been seen. They were obviously staged. And the question we ask is, what were the intelligence agencies of the world doing when this propaganda was unleashed upon the world? Were they in on the game, or were they incompetent? It's an important question. One very dubious construct, which I left out of that long list just now, is the pandemic theory itself. It's a theory that says that human society is prone to an increasing rate of pandemic emergence because humans are more connected and because we come into contact with animals more and more often. But it's a very questionable theory, because connectedness could also be held to result in the propagation of broad immunity, as diseases are pretty much spread all around the world. And so everybody will have some kind of immunity to, some member of a viral order or family. And human-animal interactions actually decline as humans urbanize, which they have been doing for an awful long time and at quite a rate. So the question itself is the notion of pandemic theory itself is questionable, and as this day is called, we need to question everything. And I would even go as far as to say that in light of the high levels of pre-existing immunity that have been observed, we need to even question the extent to which we have really been dealing with a seriously novel addition to the cluster of coronaviruses that cause respiratory diseases. In general, we know that some viral sequences are more pathogenic than others, and some express serious pathogenicity in some people. But ecologists will tell you that it's all a continuum that is exposed to natural selection, and that evolution rapidly attenuates any extremes that emerge and leads us back to the more normal dynamic equilibrium which we generally have. That may be true unless you disrupt that process with lockdowns. And we also need to question whether the actual mortality that has resulted in this epidemic isn't in a large part caused by a failure to conduct normal medical procedures of treating people the moment they present with disease, instead of waiting for them to arrive at the hospital door when they're nearly dead. And another failure is also pointed to, the failure to perform autopsies. In this hysteria and panic, autopsies were held to be a dangerous process. And so precious few were conducted. And the ability, therefore, of healthcare practitioners to learn about the disease and its manifestations was severely constrained. And the process of error correction did not occur. Pandemic theory is just a theory. It's not a fact. And I think we also need to question what happened when the WHO, after trying to launch a surprisingly kind of not famous enough fake epidemic in 2009 with H1N1, softened the definition of a pandemic. That needs to be investigated. Of all the strangeness in the last year, the piece that I find the most creepy of all is this little phrase, follow the science. Whenever I hear that phrase, what I hear is follow the narrative. And that is antithetical to good scientific process. In a rather extreme case of this, an MIT research group who were looking at lockdown skeptic organizations around the world noted the following. They said that these groups seem to believe that science is a process and not an institution, and that they were prompting people to simply think for themselves, to horrifying ends. I find it quite astonishing. But perhaps even more astonishing is the incredible degree of arrogance that was demonstrated recently by none other than Anthony Fauci. Looking straight into the camera, he said the words, "When you attack Anthony Fauci, you are attacking the science itself." The doctrine of Fauci infallibility comes to the world. And it is emblematic of what has gone on here. There has been no debate, no engagement permitted. It's censored. And it's astonishing because the scale of what has been done to the world is immense. We've also seen how this authoritarian approach gives an element of air cover to institutions like the WHO and the CDC, who have indulged in an enormous amount of flip-flopping. They've gone from what was established science prior to 2020 into a kind of pseudo-scientific world where all of those principles get thrown out, only to back out of all of that quietly after all the damage has been done. And so they've flip-flopped on herd immunity, droplet and fomite infection, PCR testing protocols, even the wholly unnecessary act of vaccinating children for a disease that they're not at risk to. And they have stuck to some incredibly dubious positions on masks, on contact tracing, on asymptomatic transmission, on natural immunity being worse than vaccine immunity, and age graduation of risk being a seldom spoken about topic. We need to question where the multidisciplinary teams were, because what we've seen is teams of narrowly qualified epidemiologists talking about models and geneticists and viral taxonomists were obsessing over nucleotide deletions and were fretting about variants. But we ask, where were the ecologists to point out that asymptomatic transmission may be actually a technique of natural inoculation at small doses? Where were the sociologists to ask the question whether a 6-foot rule was pointless in light of their findings in the discipline of proxemics? Where were the engineers to talk about the dynamics of how masks could worsen aerosol transmission? And where were the epistemologists and statisticians to talk about but Norway and but Australia being terrible ways to go about assessing policy? So, as I wrap up, in addition to this authoritarianism and this balkanization, we find that there's also a problem with institutional capture. The vaccine stakeholders and pharmaceutical company stakeholders have more or less captured every public health institution and medical university outlet in the world. And the very knowledge factory of science has been turned into something where everything that is produced is according to the whims of the funders and the grant givers. And we have a situation where journals are only publishing articles, or more or less only publishing articles, that are biased towards their paymasters. And this quadruple attack on conjecture and criticism, which is the core of science, has virtually disabled science. We have now then an environment that threatens not only to destroy science, but the very human process of growth, creativity, and well-being of humanity in general. In closing, I would make the following appeal. In order to save humanity from this shutting down process, there are 4 things we need to do. We need urgently to question this dogma of the pandemic theory. We need to recall that knowledge is fundamentally evolutionary in nature, and that decentralization is absolutely essential to preserving that evolutionary capacity. We need to restore human agency to the heart of our value systems and stop telling people what to do. And most importantly of all, we need to undo this destruction of what the philosopher-physicist David Deutsch refers to as the possible greatest of all evils, which is the destruction of the means of error correction. Without dissent, without permitting dissent, we can have no progress in science, and we will have no progress in dealing with epidemics in less catastrophic ways. Thank you very much.